Hi, we are here with our medical director, Dr. Joe Moleski. Thank you for joining us today and coming in. And we're so grateful to have you. And I would have to say one thing about aesthetics is it's really joining the wellness emphasis. And there's a lot more that people in aesthetics are able to offer to their clients nowadays. And I really love the integration because now we're empowering clients not only just physically on the outside, but on the inside as well. So tell us a little bit about your background, what you come from.
Yeah. So born and raised St. Louis. I ended up going to medical school in Kansas City, Kansas City University of Medicine. Completed my family medicine residency at St. Louis University. And then I started as a hospitalist, so a doctor that's, works in the hospital, taking care of critically ill folks. And I did that for about 2 or 3 years. Became one of the assistant medical directors at St. Clair Hospital in Fenton, Missouri. And then really kind of learned the business end of, corporate healthcare in the medical director role. And then I decided I wanted to do something more. So seeing patients come in a community-based hospital with heart attacks, strokes, diabetes, heart failure at a young age, I was seeing 30, 40-year-old people, and I thought, how could I change their trajectory of their life? And then I started getting involved in really what Jamie just alluded to is healing your metabolism from the inside out. And it boils down to, getting the weight off a patient. It could be even 20, 30 pounds. That changes their blood pressure numbers. That changes their, risk for diabetes. That, decreases their risk for multiple other comorbidities. And so I started STL Medical Weight Loss. And so I've been doing that for about 3 years. I service 2,000 patients a month. I have a large growing practice in St. Louis. And really it focuses on, instead of reactive medicine or sick medicine, where patients, wow, you got a heart attack. That sucks. Getting at the root cause of their condition early on. That 30-year-old with the heart attack, if I met that 30-year-old when the patient was maybe 23, 25 years old, started the patient on a GLP-1 or some type of peptide that prevented the obesity, prevented the hypertension, prevented that heart attack, that's something that I got really engaged with, and I devoted my whole career essentially in metabolic health. So I quit the job being a hospitalist and went for a more wellness, proactive approach.
Did you ever think you were going to be in aesthetics?
No, but here I am, and I love the team, and I think I'm fitting in well, and who doesn't want to feel good and look good?
Right. I think it goes hand in hand. I always say, look good, feel good, do good. You're better at everything when you're optimized, at your confidence level. But I just know, as an aging person myself, like, your energy levels can still be low.
Oh, yeah.
And that's where the wellness side really does come into play, because here we're empowering people physically and boosting their confidence, but they still sometimes don't have the energy to go out and show it off anymore. And for a while it sustained, in just the physical outcomes. But now, like, even just how I personally feel, and I've done things like NAD, and I really do feel the difference, just in my energy levels alone. And then of course there's like HRT and stuff like that, like in an aging person. But tell us a little bit like about the wellness and like what some of your perspectives are with all like the hype and like what are do's, don'ts, or?
Yeah. So I love GLP-1s, and GLP-1s are semaglutide, tirzepatide, liraglutide, also known as Victoza. But basically peptides, wellness, they go hand in hand. I mean, peptides are the, what they say is there's, in the future, we're just going to be on peptides. There's a doctor who's going to have their white coat and just have peptides inside. And so really medicine is shifting, I think, for, the good. I mean, patients want to feel good. They want to look good. And patients that lose 10, 15 pounds, I mean, they're going to be more excited. They're going to be more confident. And we think about how much mental health like plagues the United States. Think about how everyone's on an SSRI. Everybody's having mental health issues. But really, you lose 20 pounds, you start feeling more confident about yourself. And that's a down trickle effect in every aspect of your life, your business, your job, your family life. And so I tell patients, this isn't just about losing weight. This is about a whole metabolic reboot, and you'll reboot in your whole life. And so I know that the craze, we talk about GLP-1s, but HRT, a lot of folks that maybe lost the weight, they have a hormonal imbalance. They need, for women, testosterone. They need a little testosterone or, a progestin. And then for men, obviously TRT is very important for, when you reach a certain age and you see those declining testosterone levels, you need that. And so I think just having this open conversation with your patients, maybe they come in for a skin peel or a facial or a Botox, and then it's like, well, wait a minute, how are you feeling like outside of this? I know your skin's glowing, I know you're feeling great, but is there anything else? I mean, losing 10 pounds can take a lot of stress off your joints. Some of these GLP-1s are also used in a microdose that really helps with skin inflammation. Total body inflammation can be reduced.
Yes, like rosacea, for instance, that can usually be regulated because sometimes it's sugar induced, and when your sugar levels are right, leveled out at decent,
Yeah, and PCOS, polycystic ovarian syndrome, there's so many women that are in their 30s that come to me and they're like, wow, I want to lose weight, but I also have, irregular cycles. I have acne. I have, all the symptoms with, PCOS, and really PCOS causes infertility. And so they're also dealing with infertility. So they come with this whole host of problems. Well, what is PCOS? It's essentially metabolic syndrome. And so you're pre-diabetic, you have your pre-hypertension, you have obesity, or, you're in that overweight category. And one medication dosed once weekly can cure all that up. And then women get pregnant and their periods start coming regularly. And so a lot of folks have metabolic disease. A lot of Americans have metabolic disease. And so as providers, you're not only injecting their skin to make the wrinkles go away, but you're also going to be an advocate for that patient to be like, well, there's a lot more that we can do to not only clear up your skin, but clear up your health.
Yes. And now GLO has the opportunity to offer a lot of these services through you, and a program that we have set up, where they're getting prescribed, and it's so simple and easy. So not only does the client benefit, but now our independent contractors who are entrepreneurs in the aesthetics have the opportunity to do this over, with your oversight, and change people's lives.
Yeah. I mean, you guys obviously are operating a business, entrepreneurs. I love that. And you can also add this, I guess next level care where maybe you previously weren't offering it. We make it easy for you to offer these services through the partners that we have with Qualify and all the pharmacy partners. We make it simple so that you can offer this. The other cool thing is we're taking it a step further in comparison to our competitors. We're providing a lot of education to the providers on how to inject, what dosing, and just getting them a little bit more comfortable, because you might have a whole list of peptides and hormones and everything that you can offer, but do you really understand it? That's why I'm here. I want to make sure that you understand what you're doing, understand what peptides, and then you can use that language with your patients on a daily basis. And that's only going to help your business if you're more, enthusiastic and you're more educated on it, that you can say, hey, I know this peptide, this is going to be great for your skin, this is going to be great for your health, this is actually going to give you more energy. So at GLO, we want to make sure that when you sign up, you're also educated and you can talk to your patients.
For sure. What would be your top 3 favorite peptides?
Yeah, so I love tirzepatide, GLP-1. I love MOTS-C. It's essentially energy in a bottle that's injected. And then I love NAD. So NAD, longevity peptide, helps with mental clarity. Just take a look at what NAD is. It's throughout all your body. It connects your cells. It gives you mental clarity, and it also gives you a ton of energy and can help you live longer. So, and the tirzepatide at a microdose can help you live longer as well. We're just helping people look good and live longer, right?
Yeah, right. Longer lasting good looks.
Yeah, longer lasting from the inside out.
You'll never even know they're aging.
No, you won't.
That's what I said when I entered this industry. I was like, take a good look, guys. This is what I'm going to look like for the rest of my life. I'm not going to change from here.
Well, you could say, hey, I'm going to inject your wrinkles, but how about at a cellular level too? We then stop the wrinkles, but then we prevent future wrinkles by giving these anti-aging meds.
Yeah. I feel like sometimes, I think our system is very cost effective towards the patient or the client level. So, but I feel like a lot of pushback with clients are sometimes the costs, and I'm like, but you're gonna cut out your grocery bill.
Yeah.
Like you're gonna cut out those Starbucks drinks, and you know, so I feel like it is so cost effective because really now they're not overindulging and they're conserving in those ways.
I mean, really talking about, you know, the cost benefit with the patient, but also it's your health. I mean, so many people, you know, we have an iPhone here that we're recording on, and you think about, okay, what is it? Everyone buy an iPhone, $1,000, $2,000? I mean, you'll buy an iPhone or you'll have a Hulu subscription or an Amazon subscription, Amazon Prime, but you won't invest a couple $100s in your health.
Yeah.
I mean, really, when you start adding it up, how much is a Starbucks coffee every day? $5, $6? And then you start adding that up throughout the month, and you're like, whoa, your health, you only get one life.
Right.
So I feel like you're investing in your skin health, but you should be investing in your metabolic health.
Yes.
And you're, you know, really what we're seeing nowadays is people that understand this, the 2,000 people that I service, it's a way of life now. They can't live without it because, like you said, the excessive snacking, the grocery bill increases. We're all stressed. I mean, we can talk about we have this, that, we have this in the media, but we're all stressed. What do you do when you stress eat? A lot of that's why we have an obesity problem. And what do you get? Processed foods. And so you have to give yourself something to calm down the food cravings. Tirzepatide, semaglutide, it does that. And then on turn, you can offer this to your patients for a pretty deep discount. I mean, through the GLO Network, through Qualify, our pricing super competitive, makes it easy for the patients to afford it and the providers to offer it.
Yes. Where do you foresee this going though? Like, do you see people like being on GLP-1s for the rest of their life, or do you think that they're obtaining the healthy lifestyle they need by getting this like boost, you know, like where do you foresee like the future with this?
Yeah, so obesity is a disease of poor habits. So I'll say that again. Obesity is a disease of poor habits. And so what this does is it trains you to have new habits, good habits. So if you look at what it looks like for a person that wants to go on a diet, typically it's 14 to 21 days. You can look at Google, but they fade off after 21 days. They're roller coaster dieting. They don't know what to do. 21 days is when you're like, wow, I hit the gym, I tried, and then I'm going to give up. What the GLP-1s do is at day 21, you don't give up. And so I don't think GLP-1s are the end-all be-all. I think they're a tool in 2025 that we should use.
Okay.
And then you ask, okay, long-term. I think because of in 2025, our taste buds are so hijacked from all the processed food, that's why we have an obesity epidemic, is that really this is what gives you a fighting chance. And if everyone was able to like not deal with, there's not stress, I don't have, you know, work-related stress, life-related stress, and I was eating green leafy vegetables, and I think it would be fine, but that's not reality.
Get rid of the stress.
Yeah,
that's always the answer.
Yeah, really, a lot of Americans need this as a tool.
Yeah.
And then longevity would be, they would get off the weight.
Yeah.
Then they would go on a maintenance dose and then a microdose to keep the cravings at bay. I'm on a microdose, and I mean, you might say, Dr. Moleski, what do you do when you're stressed? I love to cook and I love to eat. I'm a thin guy, but if I let things get out of hand, I wasn't always thin. And so I noticed that like I'll stress eat, and that's just something that runs in my family. Like obesity runs in my family. I'm not obese, but if I didn't do the microdosing, it's one of those things that you can catch yourself like, wow, like why did I need 3 cookies before I went to bed? Like, was I stressed today?
Yeah.
Like, and so this just is a reminder that it keeps you in check. And
I think it's a real addiction, though. Sugar's a real addiction.
Oh, 100%.
Like, I think it just like alcohol, you know, anything else is a true addiction that people like psychologically crave and seek out, and once they start, they can't stop. So it's a lack of self-discipline, you know, to some extent. I do have to highlight, though, my biggest pet peeve is when someone's on a GLP-1 and they're losing weight too quickly, because from the aesthetics perspective, like that skin rebound, especially at a certain age, you know, 35 and over, is hard to correct. And so I do believe that when people are utilizing these, they need to do it at a slow and steady rate if we want to bounce back their collagen. But it really, you know, things like biostimulators like Sculptra, hyperdilated radius, Bellafill, whatnot, you know, is great anywhere in the body, because now they've lost this laxity, you know, and so I do feel like that's important, and a high protein diet.
Oh yeah, high protein, and we go through that with all providers. A diet that I recommend, we go through the dosing, microdosing, we go over how to do it low and slow, and we really support the providers, and then the providers get educated, and they can educate their patients, and so on and so forth.
Yes, and strength training, right?
Oh yeah.
Because of there is muscle waste that's associated. How much muscle do you think like people are losing in ratio to fat?
I don't know the exact number. I would say people are losing some muscle. If you do it right and you do it low and slow, you're not losing as much. But just simply grabbing 10 pounds and doing some strength training with resistance bands, like that can keep the muscle there.
Yes.
So, yeah, I mean, that's what I see with my patients. There is other peptides coming out in 2026 that it mitigates the muscle loss, so stay tuned.
Yeah, perfect. All right, well, anything else we should highlight?
One last thing is sexual health for women. We are going to probably be launching soon, I'm not quite sure, but we'll have something exclusive for GLO that can really target sexual health for women. And you're having women that come in for Botox and whatnot, and we feel like there is a need for a pill or a dissolving tab for women's sexual wellness, and so we'll be offering that soon.
Well, I look forward to that for sure.
Yes.
All right, well, thank you so much for taking your time today to talk to me and everybody else and whoever's going to see this, and I feel like it was super informative, and I look forward to what's next.
Yes.